So a lot of people have been asking me to cover the assassination of the health insurance CEO, and I've actually recorded this video already, but my OBS was for some reason also recording from my webcam mic. So we're doing part two. But obviously I'm coming at it from a kind of different perspective. I'm coming at it from a UK perspective. And let's just start with like a little story about myself and the UK healthcare system. So in 2019, at football training, going for a tackle, collide with a player, and I collide with one of the metal posts, right? I hit my face on this metal post. Now, I get this huge gash just above my eyebrow and going into my eyebrow, basically tearing off a bit of my head open. Black blood pouring all over my face, break my nose, and it's just swollen. And yeah, I have a really bad head injury. So what happens is we have a bit of first aid just to put something on my head. An ambulance is called. Within about 10 minutes, an ambulance shows up. I go in the ambulance. They treat me there. Then they drive me to the hospital. I wait for about 30 minutes. Then a nurse stitches my head up, gives me a butterfly stitch on my nose, which also has some scarring. And then I get an appointment for like my operation consultation for my nose. Week goes by, I go in for the consultation, I book in my operation. Another week goes by, I go to my operation, get put under, get my nose fixed, and then I'm done. And after all of that, there's no bill. I didn't pay anything. Didn't pay for the ambulance, didn't pay for the stitches, didn't pay to get the stitches out, didn't pay for the painkillers they gave me after the operation, and didn't pay for the operation. And that's because it's funded through my taxes and also my national insurance contribution. And in a scenario like mine, there was no choice. There was no choice to maybe not go to the doctors. I had a massive head wound. I could maybe die from the blood loss. And thankfully, there's not really a choice. They just call the ambulance. Who cares what my financial situation is? I'm going to get looked after. Now, British people and other people in places with universal healthcare will listen to that story and be like, of course. For most Americans, that doesn't happen. That's like some fantasyland utopia of socialism to many of them, because that is just not feasible in the American system and the American capitalist state, where of course there are programs like Medicaid and Medicare, which are designed to help people who are low income or elderly. Even those aren't great comprehensive coverage. And for most Americans, they have to pay into an insurance system that might subsidize some treatment, but also might reject you and not pay for it either. And also on top of that, the American healthcare system is notorious for price gouging. So they'll firstly be charging you way too much, and then the insurance companies that you've been paying more than I would pay my national insurance, there's a potential that they won't actually fund it and they'll only partly subsidize it. And that's why you have crazy costs for things like ambulances being like $4,000 for one ride, or even giving birth can be very expensive in America, because America is like ground zero for capitalist exploitation and complete corporate rule. I say all that because that is the context we can't forget when we talk about why people are not upset that a health insurance CEO of one of the worst health insurance companies is dead. People don't care because the vast majority of Americans, either people who pay into insurance or people who don't have insurance in the first place, can relate to why this industry is so predatory. But the elites are all shocked that we would have this reaction. Why don't we care? And Ben Shapiro and Matt Walsh were in for a rude awakening over the last week, finding out their own audience don't care either. Because even though we divide ourselves into conservative or liberal or leftist based on, yes, social values, at times manufactured culture wars, at the end of the day, there is class solidarity. Even if we don't realize it, we all have the same problems fundamentally. Here's just a little clip from the Humanist Report where he outlined this in a very good video, and I'll link it down in the description.
So it's one of the few subjects where propagandists like Ben Shapiro can't lie to their audience. But he tried to, and it did not go well. For example, on the first video that he posted where he hypocritically attacked the left, he got 4 times as many dislikes as he did likes. And on the second video that he uploaded, he got nearly 7 times as many dislikes as he did likes. And in the comment section, you see Ben Shapiro's conservative audience wake up to the propagandistic role that he plays specifically in their exploitation and subjugation in real time. Saw my lifelong hardworking father become bankrupt as a result of claims being denied after getting cancer. You were out of touch, man. Hate to break it to you, buddy, but it's not just the left who is sick of this. This just in, man with a $50 million net worth completely misses the point and is out of touch with the frustration of regular Americans. I'm not buying this left versus right shit anymore, Ben. I want healthcare for my family. Thank you, Ben, for showing us what a good dog you really are when it comes to defending your owners. Wow, maybe I've been wrong this entire time. Ben, I don't think you actually care about us. I think you just want our money. I think you want us to hate each other.
So there you see a lot of Americans who might support rich people running the government, like they just voted in Donald Trump and all these billionaires to run the government. They recognize health insurance is a scam. Because it is. Because it, like with food prices, like with petrol prices, like with everything like that, rent, most people can relate. And most people realize they're being price gouged. And in America, it's even worse than most countries. Like I said, the experience I just outlined to you of my own emergency health situation, that's a pipe dream. It wasn't even in the conversation in an election in 2024 when the UK created the NHS after World War II, when people were still rationing. In that climate, people could get free healthcare. But in America, the richest country on earth, that's not even part of the discussion. And you should be happy voting for one of 2 options who don't promise any semblance of comprehensive coverage. Now, also, Bill Burr seems to be one of the few elites who actually keeps it real. Yeah, he articulated what a lot of people felt. He doesn't care. Like, he's not supporting what happened, but he finds it hard to feel sympathy.
You know what's annoying me about this kid who killed this CEO is none of these news programs are talking about the incredible lack of empathy from the general public about this because of how these insurance companies treat people when they're at their most vulnerable, after we've all given them our money every fucking month and now we finally need you and all you do is deny us. And then these pussies and all of these things are taking the pictures of their CEOs off their websites. You know, I got to be honest with you, okay? I love that fucking CEOs are fucking afraid right now. By and large, you're all a bunch of selfish, greedy fucking pieces of shit. And a lot of you are mass murderers. You just don't pull the trigger. That's why it looks clean. That's why these people look, oh my God, oh, he was just, you know, walking into a hotel. It's like, okay, but what was his job? What did he do? What was the results of it?
So that was refreshing for a celebrity to say, but a lot of liberals like to tone police, like, oh my God, I can't believe saying murder is bad, is controversial. And they're completely missing the point and they're completely missing the conversation. Yeah, of course, lots of people will be saying this guy got what was coming to him. But what the vast majority of people are saying is, I don't care that this happened to the guy because he made millions and millions off literally killing people. So this is what I want to talk about, and this is the main point of the video. The passive murder under capitalism is tolerated by the elite and people who want to defend the status quo. So you've probably seen some like liberals who aren't that wealthy themselves tone policing about this. And that the problem is a lot of people see themselves as like temporary embarrassed millionaires, or they aspire to be part of the ruling class. And in this, they want to protect the status quo, which passively kills so many people, sometimes actively, but more passive. So when someone shoots someone in the street, terrible, terrible murder, can't condone this. When a health insurance CEO of any of the companies, when they make huge profits off rejecting people's coverage of people who pay them, they reject that and make more money, and these people die from that as well, die from a lack of coverage, die from a lack of medication, die from a lack of operations. That's not murder. And under capitalism, under austerity, under things in the UK like massive cuts to public services, this is acceptable. And I think, for me personally, an example I love to use the most is the Irish famine. Is probably the perfect example of the passive killing that capitalism does. Now, the Irish famine has always been framed as this like natural disaster. Oh my God, there was no food in Ireland. Irish people only ate potatoes. So once that went bad, they all just starved to death. But what happened in Ireland wasn't people starving to death because one of the crops they ate failed. Ireland had a varied diet that didn't just rely on potatoes. It's that most of the land was owned by people in the British elite who then kept exporting the food to England, Scotland, and various other places around the British Empire instead of feeding the Irish people. So hundreds of thousands of Irish people died and millions fled around the world. That's why there's so many of us absolutely everywhere. And if we're talking about the ideology that created that, capitalism was followed to the letter. There is nothing that happened in the Irish famine from these massive farm owners that Adam Smith would have objected to. And people have constantly throughout history downplayed this and acted like, oh, it's just like a natural thing that happened. Famine kills people. But it was this passive thing that was done over years of people being like, oh, well, I'm not killing someone. I'm not going into, this Irish family's home and shooting them. I'm just selling the food they would eat overseas and not feeding them. But that's their problem. So you see that with other things like the health insurance industry. This guy and plenty of people in the insurance industry will rationalize it to themselves. I am not doing anything wrong. I am not doing anything wrong. I am simply satisfying a market. And you can't blame me for doing this. You can't blame the people in Ireland for exporting the food. I need money. I need money. The Irish can't pay, so I'm exporting it to England instead so I can make more money. It's not cost effective to cover this person's cancer treatment. I'm not running a charity hit. It's the same brand of economics, and the things of austerity and just cutting things that people rely on. And we see this a lot in capitalist economies in regards to people with disabilities. They do not view that as socially acceptable mass murder when it is. And even then, a lot of the people tone policing about what's happened, they support Israel. They support US imperialism. So the US going around the world just killing people for capitalism to maintain an economic system that benefits them, that's not bad. That's not bad. And the whole of globalized capitalism where richer countries, mainly Western but not exclusively, we prey on poorer countries, let's take the Congo and sub-Saharan Africa, steal their resources, put dictators in place to keep them poor. Oh, that's just, what could be done about that? What could be done? These countries are so poor, it's so sad. Not that we're passively or violently interfering with the world to create this system that benefits Western nations and the Western elite. So you see Josh Shapiro, the governor of Pennsylvania, and he was in the IDF. He was writing little messages on bombs in Ukraine that were going to be fired, obviously, at human beings. And he was saying, this violence, political violence has no place in public life and everything like that. Obviously, kind of has to say that, but it's just completely hypocritical. This guy upholds the US empire, was literally fighting for Israel, and he's lecturing people about what is acceptable political violence because the elite have a monopoly on what is acceptable violence. You can see that through passive capitalist economics, which kills loads and loads of people. That's fine as long as you're making a profit, but spontaneous, really violent events are completely unacceptable. Now, I have no problem with saying what happened to that guy was unacceptable. I really don't care. If you're not a violent person, I'm not a violent person, and you don't want people running around gunning down people in the streets, yeah, I totally understand that. But what I think a lot of us want is consistency. If that is bad, then Israel's bad as well for doing all this stuff. And then the US empire is bad for doing all this stuff. And also, here's the main thing that I've seen as well. CEOs are now doubling down and getting more security. And all these politicians are talking about making people safer and everything. The one thing to make people safer is don't create economic conditions that radicalize people that may create someone like this Luigi guy. Because if the US had listened to Bernie Sanders and his popularity and universal healthcare had been passed by now, would Luigi exist? No. Would more Luigis potentially exist? They're going to potentially exist in the future because you're not going to address the problems. Like I said, my experience of healthcare is a pipe dream for Americans. A system that was created in the 40s is a pipe dream for Americans in a way richer country in 2024. And you expect people not to get radicalized just by that. And as someone who used to be a journalist that covered the pharmaceutical industry, I covered related things like the health industry, and I covered a lot of stuff to do with America. America is uniquely preyed upon by anything to do with hospitals, private medical insurance, and big pharma. because they know it's so unregulated, they can just jack up the price for everything. You pay way more in America for all your medicine than we do in the UK because there's a body in the UK that's linked to the NHS that regulates drug prices, right? That's what should be in every country along with a universal system, but it's not. And pharmaceutical companies and all these private insurance companies, they rub their hands together with the unregulated economy that is the US in many ways, and how easy it is to get in bed also with politicians. So even in Germany, which does have an insurance-based system as well, it basically is more like a universally covered system because it has more regulation than the US one. And if anything, like with what happened to Shinzo Abe, it's probably just going to start a conversation, and hopefully people listen. People are angry about this issue that affects every single American, and you can't expect them to feel sympathy for the people who profit off their misery and death, because every American family has a story about how terrible it is to deal with health insurance. And you're expecting people who have to go through that to feel sorry for someone who makes their money off making their lives miserable through this, and maybe killing them and their family members through this. So yeah, there is a solution to these things. There is a solution to people taking radical action that targets individuals at the top of the system, make their material conditions better. It's really not hard. Like I said, if universal healthcare existed, would this guy be targeting a health insurance CEO? I really, really doubt it. Let me know what you guys think in the comments. If you made it this far, thank you for watching.